And welcome back to Life Unrehearsed on our 6th anniversary show. I'm Matt Delvecchio, and we're talking with psychotherapist Dr. Anita Mehta. We were just talking about the do's and don'ts on how to communicate with someone coping with an illness or a disease. Another one of Dr. Mehta's specialties is conflict resolution. And communication also has a lot to do with it. Well, I'd like to have a little fun with this segment, Dr. Mehta. We know each other. I know you're a team player, and you have plenty of experience with conflict resolution under many different circumstances. I'm going to put you on the spot a little bit here and ask for some quick words of advice on a few different scenarios. And I realize this is a big ask, as normally you would typically do an assessment, maybe multiple assessments before offering advice. I'm going to throw you into the fire with absolutely no assessments on these scenarios. Let's get right into it. We'll call it the Ask the Therapist Rapid Fire Q&A. You all set? Ready to roll?
I think so. Let's go.
All right. Let's begin with a scenario where we've got a couple siblings and, brother and a sister. They're not seeing eye to eye concerning their parents' care needs. How do we resolve that type of conflict?
So I love how you ask for quick words of advice and you pick the most complex family situations and family dynamics for me to address, but I'll try to address that. Clearly, because you're asking the question, you know that it's not uncommon for siblings to perceive things differently. And that's really because each adult child has a different relationship with the parent, and each child actually plays a very different role in the family. So by default, then, it's important to recognize that each will react to change differently, particularly as they're witnessing someone they love go through really important, sometimes detrimental life changes. And so the key there is keeping in mind compassion. And compassion is a little different than empathy. Empathy is really saying, I feel with you. Compassion is saying, I feel with you and I'm here to help. And that's really important when you look at family conflict and trying to keep a family stabilized in a time when things can actually be quite stressful for everyone. And so recognizing that there's a process called mentalization that we talk about a lot in therapy, and it's really understanding. It's thinking about thinking, understanding what your sibling might be thinking, understanding what conflicts they may be feeling internally, and to keep in mind really what the goal is the optimal care for their loved one. And I'll actually take a minute to give a little plug to something called advanced care planning. At the palliative care residence, we do a lot of publicity on this and go out into the community. Advanced care planning is having exactly this, these difficult conversations ahead of time around when a family member starts to get unwell. What does mom or dad want? What are their care needs? What are their desires? And it's important to hear their message quite clearly so that it becomes about the parent and less about the child's perceptions. In other words, it's giving the parent their voice, so it can still be heard even when they can't use it anymore.
I'm glad you brought up advanced care planning. In fact, in a few weeks, there's actually Advanced Care Planning Day. It's April 16th. It's on a Sunday, and I'm going to be addressing this very issue. We've got a very prominent guest for that show. Very good points for that. We're going to switch it up a little bit. This is one I think a lot of parents could relate to, Dr. Mehta. Parents having a hard time with their teenagers. I hear this all the time. They don't listen. They don't know how to handle them. What could you suggest there?
Well, it sounds like the teenager is actually doing exactly what he or she is supposed to be doing. If we look, at textbook developmental level, this is exactly when they're supposed to be figuring out their identity, who they are. They're supposed to be testing boundaries and pushing back against limits. In fact, perhaps the most important thing they're doing at this time is aligning themselves socially. And unfortunately, sometimes that means pulling away from home base. And while it's hard for parents not to take things personally, it's important to keep in mind that often the challenges are really about the teen trying to figure things out versus the parent not doing something well enough or doing something wrong. Again, compassion and listening are really key processes. Often when I work with teenagers in the context of family therapy, they will say things like, Mom and Dad don't understand. Mom and Dad aren't listening. And we do this fun exercise where we have the child or the teen say something. We ask Mom and Dad to repeat back what they said, and they often can't because they're often so busy building up their own defense in terms of how to refute the teen or to automatically say no that they're not hearing. So I think the key aspect here is trying to be compassionate. Remember that we don't know exactly what they're going through, because I think we say that a lot, because it is a different generation of teen. It's a different context in which we're bringing up our children today. So taking the time to stop, to listen, and to say the same things I mentioned earlier when we were talking about chronic illness. Help me understand. Help me understand what's going on with you. Help me understand what I'm missing here can often be very helpful. But the truth is the teenager's doing exactly what they're supposed to be doing. Mm-hmm. And parents often think that they need to speak loudly to be heard instead of thinking they need to speak differently.
Help me understand. That's a question that I think it's just a simple, straightforward, but very good question to ask. Listening to Life Unrehearsed, Matt Delvecchio here, and we're talking with psychotherapist Dr. Anita Mehta about conflict resolution. I think we have time for one more here, and let's go the married couple route here, Dr. Mehta, something you're dealing with all the time. And let's say they're noticing there's a lot of conflict, perhaps even more than usual. What would you suggest?
Again, I think it comes down to communication being really essential. In fact, in this case, I would suggest that the focus may be more on prevention versus the de-escalation of conflict. In any marriage, any relationship, needs and wants change over the course of a relationship. So it's always important to revisit this. Parallel to that is reassessing your own capacity to meet the changing needs and wants of your partner. And so I'm going to mention an acronym here that we use quite a bit in couple therapy, and that's EAR, E-A-R, E being empathy. Really taking the time to understand and ask your partner how they're feeling, what's going on, what their perceptions are on things. A being the attention. Pay attention to your partner. Be assertive in a comfort zone in terms of asking what you need and what you want. And then the R, of course, is respect. And so the key principle, EAR, empathy, attention, and respect can often be very helpful. Using I statements instead of you never or you always, to put it in the perspective of feeling, I often feel hurt when you never take out the garbage. And so just flipping things around a little bit so that you don't automatically hit the defense button on your partner. And of course, if that still remains a challenge, it's important to move past the conspiracy, that conspiracy of silence where things are not talked about. So identifying things are not going well in a couple early on, presenting it as a concern, then make it a priority to address it.
Excellent. All right. Now I'm really going to put you on the spot. We're about 30 seconds. I want to squeeze one more. I get this text quite often. I say that we're talking to grandparents now, and they don't agree with the way their son or daughter is bringing up their children. If you could do this one really quick.
Okay, well, it's important not to say, we're the parents, we don't want your advice, we don't need it. Instead, I can see how much you love your grandchild. I see how much you want to be involved. I appreciate what you're wanting to do. I wonder if you're okay if we try it our way. And if we need your help, you know what? We know we can come to you. So not minimizing their contribution, asserting that you'd like to kind of take charge, and saying that you'd always come to them if you need to kind of encompasses it all.
I love it. Well, thank you very much, Dr. Mehta. How can our listeners reach you?
I do have a website, AnitaMehta.com, if anyone wants any clarifications on the quick tips that I've outlined, then absolutely you can reach out to me.
Wonderful. That's Anita Mehta, MEHTA.com. Thank you very much. Wonderful words of advice. I appreciate taking some time here on a Sunday. I know you are extremely busy.
Thanks, Matt. Have a good rest of your day, and thanks for having me on.
All right. Well, thank you. That's psychotherapist Dr. Anita Mehta. Dr. Mehta is the Director of Education and Knowledge Exchange at the Teresa Deller Palliative Care Residence. She's also a nurse care counselor at the Jewish General Hospital, and she has a private practice as a couple and family psychotherapist. Next up on Life Unrehearsed, on our 6th anniversary show, you may not know the name, but you may have heard about her on the news recently. Mrs. Margaret Romans recently turned 111 years old, and she's going to be on with us next